Hi friends, good evening and welcome back to my channel Mookambika Nursing. Friends, through my channel daily we are seeing some important points for exam. This video is the continuation of yesterday's point. Let's see today's important point. First one, the finger bones are called the phalanges, and the next point, the main bones of the hips are ilium, ischium and pubis. And the next point, the longest and heaviest bones of the body is femur. And the next point, the two bones of the lower legs are tibia and fibula. Lower leg bone is tibia and fibula. And the next point, the both tibia and fibula in the legs are held together along their shaft. That is, both tibia and fibula are held together by interosseous membrane. And the next point, the angle, that is tarsal bone. Angle bone is tarsal bone are there in each foot is 7. In each foot 7 tarsal bone. And the next point, the triangular shaped sesamoid bone associated with knee joint is patella. That is patella, triangular shaped sesamoid bone. And the next point, the shoulder and hip joints are the example of ball and socket joint. Shoulder and hip joint are example of ball and socket joint. And the next point, elbow joint is an example of hinge joint. And the next point, joint between carpal bones in the wrist are example of gliding joint. Joint between carpal bone in the wrist. And the next point, incomplete disc of fibrocartilage lying on the articular condyle of tibia is called semilunar cartilage or menisci. That is, incomplete disc of fibrocartilage lying on the tibia. And the next point, smooth muscles are otherwise called involuntary muscles. Smooth muscles are involuntary muscles. And the next point, the sheath made up of connective tissue which covers the entire muscle. That is, the connective tissue cover the entire muscle is called the epimysium, and the layer made up of connective tissue with each muscle wrapped. That is, each muscles are covered by endomysium and the whole muscles is called the epimysium. And the next point, the cytoplasm of muscle cells are called sarcoplasm, and the oxygen binding substance found in the muscle is called myoglobin. Myoglobin is oxygen binding substance in the muscle, like hemoglobin. This is myoglobin. And the next point, the region where the nerve and muscle come into close is called neuromuscular junction. That is, the junction between nerve and muscles come together is called neuromuscular junction. And the next point, the muscle surrounding the orbital cavity which help to close the eyelid is called orbicularis oculi. That is, orbicularis oculi help for close the eyelids. The muscle which help to close the eyelids. And the next point, the muscle extending from the posterior part of the orbital cavity to the upper eyelid. From upper, that is posterior part to upper eyelid, which helped in raising the eyelid is called levator palpebrae superioris. This muscle is helped to raise the eyelid. And the next point, Trumpeter's muscles is also known as buccinator muscle. And the next point, the muscle surrounding the mouth which help to close the lips is called orbicularis oris. That is, this muscle which help to close the lips. The muscle which help to close the lips is called orbicularis oris. And the next point, the muscle which help in closing the jaw is masseter. Masseter muscle which help to close the jaw. And the next point, the muscle covering the squamous part of the temporal which help in chewing. Chewing muscle is temporalis which help for chewing. And the next point, the muscle extends from the sphenoid bone to the mandible. From the sphenoid bone to the mandible is pterygoid muscles. And the next point, the muscle cover the shoulder and back. Both shoulder and back is trapezius muscles. These are today's important point.